Hey, it's Dr. Jim here, talking with you today about sleep apnea. You know, sleep apnea is really prevalent. A lot of people have it, and it's not a good thing. It's not a disorder you want to have because it has a lot of consequences. And I want to talk with you about the consequences, the risks, some of the symptoms, and that go along with sleep apnea today. So, what are the risk factors? Well, one of the things is if you're a male, you're more likely to have sleep apnea than if you're a woman. Age plays a role. The older we are, the more likely we are to have or to acquire sleep apnea over time. So that's a risk factor. Obesity and overweight, really important. Many people who are overweight and obese have sleep apnea. So that's a real issue. And one of the things, of course, to treat it is to lose weight. Genetics plays a role. The structure of your airway, the structure of your nasal passages and like all play somewhat of a role as a risk factor for sleep apnea. Some of the symptoms include snoring. We laugh about snores and the like, but it's a serious symptom and really harkens the idea that you may have sleep apnea. And if you snore and stop breathing while you're sleeping, that's almost a 100% clue that you suffer from sleep apnea and that you need to see a physician and determine it, get a sleep study and figure out what the heck is going on. If you have daytime sleepiness, if you wake up in the morning and you just don't feel like your sleep is restored, that's another major risk factor or a symptom, as it were, of sleep apnea. If you fall asleep while you're driving, if you fall asleep while waiting for traffic lights to change, you probably got sleep apnea. And obviously, that's a real risk factor because you could actually fall asleep during the day and cause a crash, and that crash could even be fatal. Depression is a symptom of sleep apnea because if your brain is not rested throughout the night, you can't think properly, and it disturbs your mood. And not only that, people with sleep apnea are much more likely to suffer from dementia, not only depression and mood disorders, but actually develop dementia over time because of their sleep apnea. Unrestored sleep is clearly a related health problem, as we've talked about, and heart attack and stroke also go along with sleep apnea. You are more likely to have a heart attack or a stroke if you have sleep apnea. So this is something that's really important you need to pay attention to. Hypertension goes along with it as well, as does diabetes. People with sleep apnea are much more likely to develop diabetes. Well, what can you do to treat it? Well, first and foremost, you get a sleep study. When you get the sleep study done, the recommendation, if you have sleep apnea, will be to wear a CPAP device, a continuous positive airway pressure device to keep your airway open. A lot of people dismiss that. They don't like it. But let me tell you, there's a cool little gizmo that goes along with this called a nasal pillow so that you don't have to have a mask covering your nose and your mouth. You just use the nasal pillow, fits up into your nose, and it works really well, very effectively to prevent sleep apnea. But you also should lose weight. You should reduce your alcohol. Smoking is also a risk factor. Exercise more frequently. Be healthy. Be happy. This is Dr. Jim. I'll see you next time.